70% of Nigeria's population is under 30, yet this crucial demographic faces significant barriers to accessing quality healthcare. With over 53% of youth unemployed, many lack a stable income, effectively excluding them from formal health insurance schemes. Policies meant to guarantee universal health coverage like the National Health Insurance Authority Act and the Basic Healthcare Provision Fund do not explicitly cover unemployed and vulnerable youth, requiring them to self-enroll and pay premiums upfront just to stay alive. In rural communities, these challenges are more pronounced. Young people have to travel long distances to access the nearest primary healthcare center, where services often lack essential resources, trained staff, and youth-friendly care beyond sexual and reproductive health. A 2024 Dean Initiative survey conducted in the Federal Capital Territory revealed that over 70% of youth are unaware of existing health insurance options or how to access them. Dean Initiative, a youth-led non-profit, is actively addressing the knowledge gap in healthcare access by engaging with young people and local health systems in communities like Kuje and Buhari. Through market storm outreaches, the initiative raises awareness about healthcare disparities affecting youth. They have trained healthcare personnel from 15 primary healthcare centers in each community, along with youth leaders, caregivers, and civil society groups, to enhance the delivery of youth-friendly services. These trainings emphasize adolescent health needs, communication skills, and confidentiality protocols, ensuring that young people feel safe, respected, and understood when seeking care. Extensive community sensitization and awareness campaigns inform youth and caregivers about available PHC services, their locations, and their importance. Since these interventions began, young people in these communities are increasingly aware of their healthcare rights and how to access available services. Jibril Sabir, a youth from Shere Ward, shared, "Before this, I didn't even know how or where to access healthcare in my area. Now I have visited the PHC twice and I feel more confident asking for help." Healthcare workers also report improved confidence and capacity in serving young patients, creating a more welcoming and effective environment at the PHC level. But challenges remain. Many PHCs still struggle with staffing shortages, lack of basic equipment, and funding delays. Existing policies still lack clear mechanisms for integrating unemployed youth into subsidized healthcare programs. Without reforms to national frameworks, community-led efforts like Dean Initiatives will continue to face systemic roadblocks. Dean Initiative demonstrates that community-based solutions combined with advocacy, awareness, and capacity building can effectively bridge the gap between young people and the healthcare they deserve. Their efforts highlight the potential for local engagement to drive meaningful change in healthcare access. When people do not have to worry about medical bills, they are more likely to go for checkups, leading to early detection of ailments that can be treated effectively. This not only improves individual health outcomes, but also contributes to overall community well-being and enhanced productivity. Free healthcare can also save more money in the long run by reducing the tendency of developing critical illnesses that require expensive treatment. It improves quality of life and can ultimately boost the economy. When people are healthy, they can work, learn, and contribute meaningfully to society. However, for sustainable long-term impact, Nigeria must reform its health policies to explicitly recognize unemployed and vulnerable youth as a priority group within its healthcare, financing, and delivery system. When young people are unable to access necessary care, it not only jeopardizes their health, but also compromises the nation's future. To learn more about Dean Initiative's work, visit dean.org.ng.